Actually, there are two field of view. One is scan field of view, another is display field of view. First, let us see about scan field of view. This is the gantry and the tube is at 0 degree. I have just shown you one projection. There are going to be thousands and thousands of such projections, but just for explaining, I am explaining using one projection. This is a projection. This is the beam exposing the patient at 0 degree. And what will happen? If you want to keep the beam open this much wider, you have to keep the collimator widened up. You have to open the collimator according to the need. Okay, you have to make sure that the entire cross-section of the patient's anatomy is covered. If you are not going to cover side-to-side coverage of the patient's anatomy, then you will end up in getting out-of-field artifact which will get manifested in the form of streaks. To avoid that, whether the patient's hands are kept down or elevated, okay, depending upon the condition of the patient, sometimes you won't be able to make the hands elevated. In such situation, no other go, you have to open the field to cover the arms also. Okay, then only that artifact will not be there. So scan field of view has to do something with the hardware. Keep the collimator open to cover the entire cross section of the patient's